In addition to sectors, the liver is further divided into 8 segments of Quinault. The segmental anatomy of the liver is dictated by the portal venous inflow. Each of the branches of the portal vein is accompanied by an artery and a bile duct, and thus each one is referred to as a pedicle. Of note, in the porta hepatis, there can be substantial variation in these structures as well, and careful attention to preoperative imaging is paramount prior to an operation. Most commonly, the right hepatic artery travels posterior to the common bile duct as depicted. However, in approximately 20% of the time, it can actually travel anterior to the bile duct. The main portal vein branches into a right and left portal vein. The right portal vein branches into a right posterior portal vein and a right anterior portal vein. Along with the portal venous branches, there is also an artery and a bile duct. These 3 structures are contained within a single sheath and thus are referred to as the right posterior pedicle and the right anterior pedicle. The right posterior pedicle supplies the right posterior sector. The right posterior sector includes segments 6 and 7. The right posterior pedicle has 2 main branches that supply each of these segments. When viewing a cross-sectional image, the segments can be differentiated by the level of the portal vein bifurcation. The parenchyma that is cephalad to the level of the portal vein bifurcation is termed segment 7, and the area of the liver that is caudal to this bifurcation is segment 6. The right anterior pedicle supplies the right anterior sector. The right anterior sector includes segments 5 and segment 8. Similar to what we discussed for the right posterior sector, the parenchyma that is cephalad to the level of the portal vein bifurcation is termed segment 8, and the area that is caudad is termed segment 5. The branch to segment 8 from the right anterior pedicle often gives off a small posterior branch as well, which actually supplies inflow to segment 7. The left portal vein runs in the umbilical fissure in the plane of the falciform ligament. Along with the accompanying artery and bile duct, the different pedicles primarily supply the left hemiliver, including the left medial and left lateral sectors. The path of the left portal vein is important to understand, but often very difficult to conceptualize. Based on the configuration of the liver, the left portal vein actually has a curvilinear path as it bends caudally toward the inferior edge of the liver. In surgery, the round ligament can be grasped and used as a handle to pull up on the liver and in effect straighten out the left portal vein. The left medial sector is comprised of segments 4A and 4B. Each of these segments is supplied by feedback pedicles coming from the left portal system. The pedicle to segment 4A arises from the left portal vein proximal to the pedicle to segment 4B. When considering the curvilinear path of the left portal vein, the area of liver that is cephalad to the portal vein bifurcation is termed segment 4A, and the area that is caudad is segment 4B. The left lateral sector is the area that is situated left of the falciform ligament and consists of segments 2 and 3. Note that the left hepatic vein actually separates these segments as it traverses the left lateral sector obliquely. Segment 2 is the area of parenchyma that is superior and posterior to the left hepatic vein. The pedicle to segment 2 arises across from the pedicle to segment 4A. Segment 3 is the area of liver parenchyma that is situated inferior and anterior to the left hepatic vein. Note that the pedicles to segment 3 and 4B form the terminal branches of the left portal vein. Caudate, Segment 1. The caudate lobe exists from the most caudal portion of the liver and extends in a cephalad direction. As the most superior aspect of the liver is reached, which is near the confluence of the hepatic veins, the caudate lobe ends. In the actual liver, there is really no distinct boundary or landmark for this, but note the close proximity of the middle hepatic vein to the caudate lobe at the cephalad aspect of the liver. The caudate is referred to as segment 1. This area refers to the portion of liver parenchyma that is situated in between the portal vein and the IVC in an anterior and posterior dimension. The area that is directly anterior and left of the IVC is termed the caudate lobe, and the area that is right of the IVC is termed the caudate process. This caudate process fuses with the right posterior sector. The venous drainage pattern is unique from other segments in that the caudate has short veins that directly drain into the IVC. The number and size of these veins, however, is variable. The caudate lobe is primarily supplied by small branches directly coming from the left portal vein. The caudate process is primarily supplied by small branches coming from the right portal vein. The arterial inflow and biliary drainage of both the caudate lobe and process maintain the same pattern as the portal system.